It's a big pleasure to be here with all of you. Okay, so regarding to this topic, this is a brand new topic because of the brand new disease we have now. As you know, COVID outbreak is an unexpected event worldwide, and it's creating a big challenge in all medicine specialties in the society, definitely. We do know that coronavirus is involving testing and even stressing all the national health systems all over the world. And you know, it's not a war. It's not a war, but it's something similar. And when you want to fight against the enemy, we need to recognize its behavior. In this case, we have to recognize the behavior of the virus, and we have to recognize the damage that the virus gives to the human body. So that's the reason of this webinar. Multidisciplinary activities will give all this arsenal of weapons to know physiopathology and epidemiology of the virus. So what about our specialty and the coronavirus? Well, at the beginning I was very surprised because I was reading something about the SARS infection in 2003 and the MERS infection in 2012. So the coronavirus belongs to a family virus that have a particular ability, is to get into the cells through spike S protein and AC2 receptors. What are AC2 receptors? They are angiotensin converting enzyme receptors that they are present in lungs, as we know now. The main disease that the coronavirus is producing is pneumonia, and even small bowel, kidney, heart, thyroid gland, and surprisingly for me, testis. Why testis? Because the testis has a lot of ACE2 receptors, especially the spermatogonia. So you have to know that spermatogonia are the cells that will become sperm. This damage can be done in 3 ways. The first way, and maybe the most important, that happens at the first phase of the infection, in the viral phase, and depending on the viral load. So the virus enters inside the cell and via ACE2 receptor, so create more RNA and permit that the virus can reproduce freely. And in the second phase of the disease, called immunogenic phase, there is a severe immune damage produced by, as some physicians say, as cytokine storm. And finally, and as every viral or bacterial infection is due to fever, to the temperature that, as you know, spermatogonia, they need a relatively warm environment to make a proper function. This is the structure of the virus. This is a typical RNA virus with a simple chain inside, spike glycoprotein. And I have read in some papers that maybe not only spermatogonia have these ACE receptors. Maybe Leydig and Sertoli cells have the same receptors. What are Leydig and Sertoli cells? Well, Leydig cells are the main cell that producing testosterone, and Sertoli cells are supporting cells to the spermatogonia. So if there is not only affection to the spermatogonia, and there is affection to Leydig and Sertoli cells as well, so therefore we can have an hypothetical influence of testosterone production. But at the moment, this is only theory, because there is no peer-reviewed papers, only short discussed papers in China. I only found 3 papers. So, as you know, now the priority is not reproduction, is not fertility. Now the priority is researching researching treatments, researching the vaccine to life-threatening effects of the virus, of course. But in the future, the male infertility related to the COVID and other uroandrological disorders will create a lot of papers, and we will open a new research line. But to do it, we only need time. We need time, maybe months or maybe years. We will have a lot of papers, a lot of doctoral theses, so we will have a lot of work. But I think now is very soon. And of course, we will need a large series, randomized and non-biased research. Here, 2 or 3 papers I have found, written in China, of course, because the outbreak started there. They are the people with more experience now, of course, logically. Human sperm, as you know, takes 60 days to form. And recovered patients could still return after the period to provide a sample. But here is the problem. We could not be sure about fertility if patients weren't tested before. So maybe we have patients with problems with fertility before the outbreak, and we cannot count as healthy reproductive patients after and before and after the COVID infection. But I think one of the more important topics is to test the male hormone profile. Because as you know, one of the places where coronavirus 19 acts, it's over the central nervous system. As you remember, one of the symptoms of coronavirus infections is anosmia, is the disability to smell. And disability to smell is related to central nervous system affection. We can say that maybe the hypophysis testis axis function is affected as well. So I think it gives you a lot of passion to study in the future this problem, but we need time. We need time to do this. And me, as an European Spanish urologist, what we are doing in my unit, and I think Dr. Hanan and all the audience, I think the most important thing we are going to change in medicine is that we're going to promote telematic consultation. This is going to be the future, and this is the present too. Now we perform only oncological surgeries and only urological surgical emergencies because our hospital, for example, in Palamos, the place I'm working now, so 2/3 of the wards are busy with coronavirus patients. And we need time. We need time to come back to our daily work. And we have coronavirus and non-coronavirus operation theaters. And before and in every elective surgery, we perform a COVID screening. And of course, I think it's the most important, not only in the hospital, outside and everywhere, is safety, mask, protections, that we have an important lack of this. Thank you very much.